Hi, my name is Abbey McCarty, and this is my YouTube video for Dr. Levy's SED 602 class at Touro College. I'm going to be discussing Down syndrome and how the use of technology can be very effective when working with students with Down syndrome.
Down syndrome occurs when an infant is born with an extra chromosome. These individuals are born with 47 rather than 46. Usually occurs on chromosome 21, where there's a third chromosome rather than just two. This extra chromosome affects the individual's physical and mental development, and it also causes some health problems and medical conditions. Down syndrome is typically a random occurrence. There's usually no behavioral or environmental factors that causes Down syndrome. However, the chance of having a baby with Down syndrome is higher as the mother's ages. So a woman who's 30 years old has a 1 in 1,000 chance of having a baby with Down syndrome, while a 40-year-old woman has a 1 in 100 chance. Down syndrome is also the most common genetic cause of mental retardation. Individuals with Down syndrome typically have very identifiable characteristics. Some of these are a flattened nose, a single crease in the palm of the hand, small ears, upward slanting eyes, wide short hands with short fingers, and an extra flap of skin over the innermost corner of the eyes. The diagram on this slide points out some of these characteristics in more detail. So there's a lot of characteristics that kind of identify individuals with Down syndrome. Individuals with Down syndrome face a lot of challenges, both medically and in their learning and development. Some medical problems that they have are congenital heart disease. Nearly half of them will have this. Most need glasses because they have eye problems. They also have hearing problems, sleep apnea, obesity, and constipation. And some of the learning problems that these individuals have are impulsive behaviors, short attention span, slow learning, delays in speech, and trouble communicating. They also learn at a varying rate and capacity. And later in life, when they become more aware of their disabilities, they can have anger and frustration problems. Using technology can be very effective when working with students with Down syndrome. Our book describes assistive technology as equipment, devices, or services that help compensate for an individual's disability. Students with Down syndrome can benefit from technology because it can help them communicate, improve their fine motor skills, and improve their peer and social interaction. iPads can be a really effective tool to use with students with Down syndrome. Some of the apps that I found were from the website a4cwsn.com. It's apps for children with special needs. The first one that I want to talk about is Arctic Pix, and it's a great app for students with speech delays. It helps them with communication and expressing themselves. There's a lot of flashcards on there and matching activities, so you can focus on one letter and students picking out the cards that match that letter or start with that sound. It's a very interactive app, and it's really good for students with speech delays. Another one is Dexteria, which is a great fine motor app. There's a lot of tracing and copying and matching pictures and images. It helps increase coordination and motor control in hands and fingers, which is really good for students with Down syndrome because they often have low muscle tone, so they might have a hard time gripping pencils or using scissors, so this is a great way to get their fine motor skills working. The last app I want to talk about here is an autism letters, colors, and numbers, which was actually developed for students with autism, but it can be really effective with students with Down syndrome. It's a great app to help students match letters, numbers, sounds, colors, and pictures. Again, it's very interactive. It's just them using their fingers and fine motor skills. So these are three really great apps that you could use with students with Down syndrome. This final app is called Prolog to Go. It's a really great communication app that helps students say exactly what they're thinking. It has different categories that students can choose, and they tap the screen for whatever he wants to say or whatever he needs. So basically what he sees, the computer can verbalize for him. This is great for students who are not speaking or don't have the communication skills yet. So it's really good for students with speech delays and things like that. Generally, students with Down syndrome, their frustrations come from the fact that they can't communicate what they need or what they want. So this is a great app for them, and it kind of can decrease those frustrations and those outbursts of anger or misbehavior because they're not able to communicate. So as you can see, there's a home screen, and you can go into categories, and you could say I need, and then you would click on if you need food or a toy or something like that. And the next one is if you want food, I want, and the student would click on blueberries or a banana or whatever he wants. There's also a section to type, so students can learn how to type what they want if the picture's not there. It's a really, really good app. It gets students really involved, and it gets them communicating when they aren't able to actually express themselves. So this can be really effective for students with Down syndrome also. This link is a great video. It was a news report done on a student with Down syndrome using the app Prologue to Go to communicate in class and at home. It really demonstrates how effective this app can be and how it helps these students communicate and express themselves in a really positive manner. Smartboards are another great tool to use for students with Down syndrome. On this slide I have 3 websites that have pre-made lessons. So you would just go and type in the grade, the subject, and the category and search the lessons that way. They're already developed. They're very interactive and hands-on. These are great for students with Down syndrome because it gets them actively involved. It gets them interacting in the lesson, interacting with their peers. Often students with Down syndrome who can't communicate or verbalize what they want to say get frustrated. So Smartboard is a great tool because they can show you what they know or they can show you the answer. So this is also really fun for students. So it's a great tool to use for students with Down syndrome and students in a general education setting. Dynavoxes were created in 1983. They were one of the first communication devices out there that helped students express their needs and wants. It's similar to the iPod app that I was talking about earlier in that you touch the picture or icon to express your needs. So you would touch it and the Dynavox verbalizes it for you. Again, it's another really great tool for students with Down syndrome who have trouble communicating, who are nonverbal. So this is a great way to kind of ease their frustrations and let them express themselves the way they need to. In 1929, the life expectancy for an individual with Down syndrome was only 9 years old. Today, they have a life expectancy of at least 50 and sometimes more. Many enter the workforce and successfully maintain employment. Many can form lasting relationships and live semi-independently. It's really important for individuals with Down syndrome to have a really good support system. Often they experience memory loss or dementia as they get older, so it's important that they have a support system that can monitor them to make sure that they are able to function independently. The development of technology and the use of technology with individuals with Down syndrome is really important, and it can be really effective. It helps them communicate better. It helps them interact with peers and with teachers and professionals and families better. It is a great tool for fine motor skills and just to get students with Down syndrome interacting and communicating more effectively.